All right, let's dive right into this explainer. Today, we're going to permanently untangle HIV and AIDS by tracing the exact step-by-step clinical progression from the very first moment of infection all the way to advanced disease. For decades now, you've probably heard these terms used completely interchangeably, but medically speaking, they are absolutely different things. So we're going to look closely at the data and clearly map out this biological journey.
So we're kicking things off with a huge question, one that honestly causes a ton of widespread confusion. Are HIV and AIDS actually the exact same thing? If you ask the average person on the street, you'd probably get a yes. And it's a super easy assumption to make, right? Because they're inextricably linked. But treating them as synonyms totally obscures the medical reality of how the human body actually interacts with this specific pathogen over time.
Well, to answer that, we really just need to look at cause and effect. HIV is the literal virus. It's the cause. AIDS, on the other hand, is the resulting syndrome, the effect. Think of it as a very strict cause and effect relationship. You simply cannot have the effect without the cause. But, and this is key, having the cause doesn't mean you immediately or inevitably experience the effect. They're two completely distinct points on a clinical spectrum.
Okay, moving into Section 1, the virus versus the syndrome, let's establish our baseline. By definition, HIV, which stands for Human Immunodeficiency Virus, is the actual physical virus. It's this microscopic invader that gets into the body and actively targets and wipes out your immune system's CD4 T cells. Think of these T cells as the generals of your immune system. They're the white blood cells whose entire job is to coordinate your body's defense against infections. HIV specifically hunts down these vital cells, enters them, uses them to replicate itself, and then absolutely destroys them in the process.
Now, in stark contrast, AIDS, Acquired Immunodeficiency Syndrome, is not a virus at all. It's a late-stage condition or syndrome that only happens after the immune system has been severely damaged by the prolonged presence of HIV. Notice that word acquired. It's a syndrome you acquire only because the virus has successfully broken down your cellular defenses over a long period. You don't catch AIDS, right? You catch HIV, and without any medical intervention, it can progress into the syndrome known as AIDS.
Right, let's look at how this builds chronologically in Section 2, Stage 1, Acute Infection. This is all about the initial invader.
Looking at the big picture of how this disease progresses, this acute stage hits fast, usually just 2 to 4 weeks after someone is initially exposed. It's a super short window at the very beginning of the journey, way before any sort of chronic infection sets in. It's basically the body's rapid, immediate panic response.
During those first couple of weeks, the virus is just multiplying like crazy in what's essentially a hostile takeover of the body. And this massive viral replication triggers some pretty severe flu-like symptoms because the body is desperately trying to mount a defense. Patients often experience intense